and newsletters, for example, and to be more electronic and posting to our website. We are looking at some minor mileage reimbursement, and the reason I say minor is that much of our service is requires staff to be out in the community, so it does require travel. So there wasn't a lot that we felt we could do there, but we did feel that we could make some reduction by increasing our reliance on technology for some of our meetings. We do believe that because our staff are in multiple locations, it is important for them to come together on a regular basis, but for some meetings that could be done by teleconference or webinar services. We did reduce our consulting fees, and we had, in the original budget, we had included some consulting dollars to advance the audit recommendations, and we are doing that through reliance on our management team. And there are some potential timeline delays. At this point, we don't believe that those are jeopardizing our overall achievement of the audit recommendations within the times that were defined, but we will certainly continue to watch that. And then the final way that we did reduce was by not moving forward as directed. We did not move forward with the membership in the ALPHA, the Association of Local Public Health Agencies. In the end, we were able to reduce our budget by more than what was required. And in fact, so the total that's on the third page of that memo shows it as being slightly more than the 143 that was required and requested rather, but we were actually closer to $150,000 reduction. We are certainly looking at what are the opportunities to augment our budget through one-time funding requests, and there is another report on this agenda that will address that. So with that, happy to answer any questions.
Well, thank you very much for the report, Susan, and certainly the work in accomplishing some reduction measures in the budget. Wells, and then Mr. Oliver.
Thank you, Mr. Chair. Mr. Chair, I don't have a question, but I do want to make a comment, and my comment is to thank staff for going through their budget with a fine-tooth comb and finding some savings. That's certainly greatly appreciated. And when the budget comes up for the motion, I will make a comment then. But that's all for now.
Thank you. Mr. Oliver, then Mr. Height, please.
Thank you very much, Mr. Chairman. Susan, I do have one question, and one of the bullet items at the bottom of the second page that I'm a bit concerned about, and that is removing our reinstatement of our health unit within the Alpha group. And I recall the discussion at budget about this item, and I believe I was one that supported, I can't recall if it was unanimous, but supported putting the money in to go back into the Alpha group. What is the cost of that annual membership?
Through the Mayor, the cost for Haldeman Norfolk is actually with HST $7,189. Okay. However, because of having gone through the first quarter, it would be prorated for this year if we were to reinstate for April the 1st, and the cost would be $5,392, and that is the lowest rate. It is done by population based on the mandatory programmings from the Ministry of Health and Long-Term Care. So the Haldeman Norfolk Board of Health is actually at the lowest possible rate to be reinstated.
Okay, thank you very much for that. Then my next question, because I happen to think that is important for us, but I'm going to ask you to go to the chart at the top of page 3, and I see we were only successful in reducing the levy impact within the Smoke Free Ontario program 100% funded, even though we subsidize it by nearly $19,000. You only could find $1,300 worth of savings. What would be the implications if council or if the board were to direct that you find the $5,400 within the Smoke Free Ontario budget and reinstate the Alpha membership for this year at least?
So if I may, through you, Mr. Chair, in fact, the total reduction that's here is an underestimate, because after we completed this report, we did realize that we had made some additional savings through that epidemiology position than what we had anticipated. So if in fact we were to be reinstating into Alpha, there would not be any change to our reduction of our target at $143,000. We would still achieve that because we have actually overachieved.
Oh, Okay. All right. Well, I
Yes.
guess in that case, Mr. Chair, I will not pursue the angle that I was pursuing, because I was in fact going to ask that we direct that 5,400 go back in there, and that we find that 5,400 in additional savings within Smoke-Free Ontario for this year. But staff have said, if we direct that we put that back in, we don't have to do that because you've overachieved on those savings. Do staff, Mr. Chair, need direction from us then to reinstate our
It
membership
is in the
Alpha?
recommendation, in the report.
Sorry?
It's the last bullet of the recommendation.
I'm very sorry.
Oh,
I
it's
didn't-
okay. No, I know what you're getting on page 42.
Thank you.
Okay, so will be up for consideration. Mr. Height and then Mr. Brunton, please.
Thank you, Mr. Chair. On page 10 of our agenda for this Board of Health, we've just approved the minutes, so we've ratified the budget. It says that the Association of Public Health Associations membership in the amount of $10,000 be removed from the budget. Is that this amount of money, the alpha?
Through you, Mr. Chair, yes, it is. So originally, when we did the original budget last fall, we had put in $10,000 as the amount. In fact, it is less than $10,000. But we did remove the $10,000 as directed by the Board of Health at our last meeting.
Do we not have to have a vote of reconsideration, considering we just ratified that 20 minutes ago?
Through you, Mr. Chair. No, the budget hasn't been finalized yet. If you read down in the minutes, the Board of Health budget is still ongoing. We're actually technically in a budget meeting right now. And as you recall, when you started the budget meeting, there was a rule put in place that any item could be changed at any time before the motion to approve the final budget was passed.
Okay, so further to what Councillor Oliver said, do you have the money in here, or will you have to get the $10,000? Like, will that line item have to be wiped off?
So through you, Mr. Chair, we could reinstate our membership with Alpha and still achieve the $143,000 targeted impact to the levy.
Was the 143 including the 10,000?
The 143 target included removal of the 10,000. So we're saying that we can actually still hit 143 and join Alpha.
Okay, thank you.
Okay, thank you. Mr. Brunton, please.
Yeah, thank you, Mayor Luke. We had quite a discussion at the committee level in regarding this reinstatement. But I got a short memory, Marlene or Susan. Can you remind me, what do we get for that $7,000 again? I know you told me a lot of things at the advisory meeting, but what does $7,000 in membership give us?
Okay, through you, Mr. Chair. So $7,000 in membership means that so right now, Alpha represents 35 of 36 public health organizations across the province. We are the only public health unit not to be a member of Alpha. Alpha is an advocacy group, and so it does things like collects feedback from the public health units on the discrepancy between what their capped funding is and what it ought to be to meet the 75-25, for example. We're the only ones now, by chance, they have invited us to be part of a survey that they were doing in that out of courtesy to include us, but they didn't really need to do that. We are the only ones that are not part of that group. When the new standards were coming out, there was a release of the standards along with some presentations from the ministry and some presentations from other public health organizations. Again, it's an invitational event that was only open to Alpha members, and thankfully Alpha was quite gracious and invited us to attend that. But really, technically, we would be the only health unit who was not at the table for that. In addition to that, what they do is they do provide resources, proprietary resources, resources to their members. So for example, as our audit, as we went through our audit recommendations, there were a number of pieces of work there that we could actually go to Alpha Materials if we were a member, use their materials and deliver those quite quickly and quite easily without cost, because membership entitles you to use those materials. In the absence of membership, what we need to do is recreate those materials here locally, which would require substantial investment of staff time and energy. So certainly those types of things I think are the important factors or things that Alpha delivers.
Okay, well, I guess, I look at it like, I know, I'm sure Public Works are involved with Ontario Good Roads, and I know those memberships, there's a fee for all those things, but like this fee of $7,000 only included membership. It doesn't include all the social things where you go and collect data or go to wherever they meet and things like that. $7,000 is only for the membership, correct?
Yeah, so through you, Mr. Chair, so $7,000 in membership entitles you to access the resources, to be included in the data collection surveys and included in any reports, for example, that are going to the ministry. So it is a membership fee that entitles you to use proprietary services, resources as part of Alpha.
Well, I do recall, I did support it at the committee level, but I really question, a $7,000 membership fee seems excessive, but again, I do support being a member of it, being as we are the only ones that were not a member of it, and but it just sounds excessive, and I'll leave it at that. Thank you.
Any further questions? Moved by Mr. Wells, seconded by Mr. Columbus, that staff report HS 1704 be received as information and that the Board of Health approves the revised 2017 public health budget, and further that the membership for Alpha be reinstated for 2017 from the excess reductions in the public health budget resulting in no levy impact. Discussion. Councillor Wells, please.
I'm just going to make a comment here, Mr. Mayor, based on Haldeman's Board of Health representatives.
Yes.
I realize, as does Haldeman, that Norfolk County acts as the Board of Health for the two counties. We are well aware of that. Unfortunately, at budget time, Haldeman has little say or input after the proposed budget comes to Norfolk County Board of Health. Haldeman feels somewhat upset by the reduction of $145,000, even though they were supposed to be at 100% provincially funded programs. They had no say in the cuts. They, meaning Haldeman. What they are requesting, and realizing full well that Norfolk is the Board of Health and can make the final decision. They're not objecting to that, Mr. Mayor. But they are requesting that as soon as the changes, if they are made from the Board of Health, that they go to Haldeman Council so they are made aware of what changes we are recommending. And that's a change that they would like to see, and I would like to see at our next budget session, whenever that happens next year. That's all, Mr. Chair.
I'll comment in a moment. I'll hear Mr. Brunton first. I'll hear you first. Yes, Mr. Brunton.
Yeah, and further to, if I may, Mayor Luke, the Councillor Wells, one of the discussions we had at the meeting was that perhaps the budget from the health board should go before the advisory committee first before it goes to any council. That way Haldeman's representatives who are on the committee will get a chance to see it. I think that's fair. I know we've discussed recently with the Economic Development Committee terms of reference for that committee that they would see the budget for that particular department, and Mr. Baird's indicated they would. Now, I think it's somewhat appropriate that Haldeman, being on the committee, see the budget. So I hope that's the practice we undertake this year when we do the budget. So we'll see where it goes. Thank you.
Well, that was very close to my comment, Councillor Brunton, when Councillor Wells has brought that up, and certainly with my 4 years of serving on the advisory committee, I too was going to say I see no reason why as most of the reports we get always come through advisory, not all, but most. And I don't see any reason why the budget can't be run through so Haldeman can have a look before it comes further. And any motions or any direction or guidance, I'll put it, from the advisory would certainly be welcomed by me. I can't speak for the rest of the board members, but I think your suggestion is valid. Marlene, is there any thoughts? I'll go to Mr. Black in a moment. Any thoughts on that possibly happening? I know there's a timing issue.
Thank you, Mr. Mayor. A few things. First of all, you're absolutely correct. It has not historically gone to advisory committee, although all other reports do go to advisory committee. We do, however, go after the budget to Haldeman budget, which is delayed. Theirs is typically sometime late February, March, and the senior team from Health and Social Services does go and present and answer any questions. So that's the historical. However, during this budget cycle, the senior staff at Haldeman had approached us and had wanted to have some consultation and preview of the budget for some input and potentially to the advisory. Unfortunately, with the timing, it just didn't allow for that. So Haldeman and I were putting a proposal forward and trying to work through all of the schedules to enable that engagement and opportunity for feedback for the next budget.
Mr. Black?
Thank you very much. And what about the idea of letting Haldeman be the Board of Health? We can alternate maybe every 4 years or something like that.
Mr. Black, I have made that offer informally to Mr. Mayor Hewitt twice now, and both times he has not indicated a willingness. But I thought it would be time for them to take a turn, but I also know that legislation from the province would have to be approved to make a change in the legislation. Marlene, do you want to comment? I mean, I shouldn't be offering it without this board's, but I was doing more of a conversation. If they wish to, they could request it, and he declined, yes.
Through you, Mr. Mayor, there is no opportunity at this point to allocate that to Haldeman Council to become the Board of Health. However, as we await the expert panel, we may get some direction on what the governance may be looking forward. So we'll wait and see.
Well, what exactly is that legislation that governs, that says that, Norfolk County must do it and Haldeman is left out?
Through you, Mr. Chair, I can answer because I've done a bit of preliminary research on the file. The Town of Norfolk Act actually is the piece of legislation, and within that piece of legislation, it sets out that by such a date, which I believe it was January 1st, 2001, if the transition committee did set in place a Board of Health structure, that would be reviewed by the ministry and approved. So I think the thing that we have to look at now is if that is to change, do we need a private members bill now, or is it because it's the structure and the reporting, including the Health and Social Services Committee, is outlined by the transition board?
Okay, well, that's interesting to know. So, but anyway, thank you very much.
Any other discussion? I did read the resolution. It's before you on page 42, word for word. No further discussion. Those in question? Those in favor? Seems, is it not 9 o'clock yet? That's carried. Thank you. It's carried. Thank you. Susan Taylor again, page 40, implementation. No, next one. I'm sorry, 42. No, next one. Pardon me. Program-based grants for 2017, page 46. Sorry.
Thank you, Mr. Chair. So this particular memo identifies the submission that we've made to the Ministry of Health and Long-Term Care for our base funding for the 2017 year. What you'll recall is that our funding is divided. Some comes from the Ministry of Health and Long-Term Care, and some comes from the Ministry of Children and Youth Services. So this is only the portion that's from the Ministry of Health and Long-Term Care. From a base funding perspective, there is the equivalent of 64.41 FTEs that are part of our base funding request. So this is all of or it's a subgroup of the budget that we've discussed previously. And it represents about $7.5 million in total funding requests. So some of that is coming from the ministry, from a perspective of salaries and benefits, and some would be from expenditures that would be to operate those particular programs. In addition to that $7.5 million that was submitted for our base funding, we have also submitted 10 grants for one-time funding, totaling $325,000. And that is to provide us with some support for the work that we're doing. So, for example, they're listed on page 2 of that particular memo. Historically, the third one down, public health inspector student practicum. We've always hired 3 public health inspector students, and we've paid for it out of our budget from the health unit. And so what we've done this year is we've made a request for one-time funding to offset those costs. So this would not be representative of 3 additional FTEs. It's the existing FTEs, and we've made that request so that it would help us to alleviate some of the budget pressures and alleviate some of the levy requirements. The other things that are in there, some of those, these are representative of some items that we would only do if we receive the funding. So, for example, the implementation of audit recommendations, we have requested $32,000 from the perspective of helping to advance those audit recommendations, and that would represent hiring of some support, some consultant support. If we don't get the money for this, we won't do it. These are the sorts of things that if we do, it will help us. If we don't, we'll figure out a way to do it within our existing staff complement. Likewise, there are some items in there around the facilities assessment, for example, around the redesign of clinics within Caledonia and Dunnville, and that would be to be sure that we're able to offer safe space for our staff. Again, we've requested some money to support that, but if we don't receive that money, then we would be figuring out a way to do that within our existing budgets. Okay. So with that, if there's any questions,
Susan's memo is for information, but I will entertain any questions. Mr. Height, please.
Thank you, Mr. Chair. Through you to Susan. On the list down there, you have a Healthy Menu Choices Act 2015 enforcement.
Yes.
So we're enforcing this from 2 years ago, or was that when the act was in place? And what type of enforcement will we be enforcing on menus?
Yeah. So this is the legislation that just came into being, and the implementation of it was actually just a couple of months ago. So just in January of 2017. So the act passed in 2015, but the implementation just came into play. And this would be the types of things that our inspectors would do around when you go into chain restaurants. Have they posted on their boards, what the caloric value of various items is? And so there is a schedule of expectations that we have from the province around going in to do that. It's very likely that we would get that $17,000 to enable us to carry that out.
This is about the calories on the items, but it has to be a chain restaurant, does it not? Do family restaurants have to do this?
I believe that they need to have, through you, Mr. Chair, I believe they have to be restaurants that have more than 10 locations. So a family restaurant that just has one location isn't included in this.
So in Norfolk County, would you estimate, 10 locations would qualify for this?
Through you, Mr. Chair, I'm not sure exactly, but we could certainly find that out. No?
Seems like a waste of money to me, Mr. Chair. Probably McDonald's has probably got it together. Swiss Chalet, all the chains probably do, and here we go, $17,000 to throw away.
Anything further? Mr. Oliver?
Thank you, Mr. Chair. The two that I want to ask about, Susan, are again related to the Smoke-Free Ontario program. If you don't mind, you're showing additional one-time only activities for youth engagement of $21,000 and additional programming for smoke cessation for 30,000. So in other words, of 51,000 proposed additional expenditure above and beyond what we do now. That's essentially what this is. Am I correct there?
So through you, Mr. Chair, so I'll speak first to the nicotine replacement therapy. So we have in our budget, there is some money that's built in for nicotine replacement therapy. What this will do is it will actually offset that expenditure. So we wouldn't be going out and buying $29,996 more of nicotine replacement, but the money that's in our budget that's earmarked for that, this would be a way for us to recover that money so that we're not having to pay that from a health unit perspective. So this is part of the funding. So some of the funding is provided as base funding, and some of the funding is provided as special projects or one-time funding.
So in other words, then both of these items, moving back to the chart on page 44, the previous report, you're telling me then, I think, that both of these one-time items are within the $363,500 budget for Smoke-Free Ontario initiatives?
I know that okay. So if we don't get the nicotine replacement, then we won't spend it. And the youth engagement is for a health promoter, and that is within the budget.
Okay, thank you.
Anything further? Moved by Mr. Sonnenberg, seconded by Mr. Oliver, that the memo respecting program-based grants 2017 submissions to the Ministry of Health and Long-Term Care be received as information. Is there any more discussion? If not, those in favor? It's carried. Thank you. Another memo on page 48, financial controls checklist. Susan?
Thank you, Mr. Chair. So the financial controls checklist is actually a new process that's been put in place in 2017. And what it requires is for public health units once a year to go through their financial processes and ensure that they have, in fact, got processes in place for things like, and there's 4 components, and those are all attached. It is financial information and making sure that it's completely and accurately collected, recorded, and reported. The second is around revenue receipts, that they are collected and recorded, procurement, payroll, and expenses, that those are processed according to policies and directives. And the fourth is that the fund disbursement to prevent and detect errors, omissions, and fraud, that there are processes in place. So this is really a checklist that allows us to ensure from a due diligence perspective that we are compliant with all of the financial and auditing requirements that are associated with the transfer of funds.
Questions? By Mr. Oliver. Sorry, go ahead, Mr. Height.
Sorry, thank you, Mr. Chair. A lot of this stuff has to do with the procurement, where we had a lot of problems in our process before. Now, I understand Norfolk County is going through the centralized purchasing. Are you guys working with them? Is that how it's going to be, or do you have your own little department?
So, go ahead. That's fine. So through you, Mr. Chair, so certainly we do work with the county wherever possible. So if it is something, and procurement is a terrific example, where we work with the county, we're actually one of the first areas that will be instituting the procurement, centralized procurement, and so that will actually allow us to have that standardization across all county departments.
Okay, thank you.
Mr. Brunton?
Just on the, kind of on the same note, if I'm right, Marlene or Susan there, we used to have, one of the audit recommendations was we got rid of the financial manager, or whatever he was called, I forget the title, but now are all our finances and records going through our finance department?
Through you, Mr. Mayor, to Councillor Brunton, yes, they are. Everything goes through finances currently, and will continue to do so moving forward.
Thank you.
Anything further? Moved by Mr. Oliver, seconded by Mr. Wells, that the memo respecting financial controls checklist be received as information. Discussion? Those in favor? Carried, thank you. On to page 55, Susan has a further memo, operational audit, and implementations of recommendations. Susan, please.
Thank you, Mr. Chair. So as folks will recall, back in 2015, we participated in an audit to assess our compliance with the Ontario Public Health standards, the organizational standards, and the accountability agreement for public health funding and accountability. As a result of that audit, there were 42 recommendations related to the organizational standards and 6 recommendations related to the accountability agreements. That report, which is attached to this particular document, was finalized in February of 2017. What we've seen is, since we've received the report, that about a third of the recommendations related to the organizational standards have been implemented. So that was 13 of 42. Half of them are in progress and on track, and the remaining ones are underway, but in 6 of 42, there are some minor deviations, and those relate back to my earlier comment around, some of the pressures have slowed us down a wee bit, but we will certainly be on track as far as the implementation schedule. There are 2 that are highlighted on the attachment. One that was under review, which was the appointment of a full-time medical officer of health, and the second was the inclusion of Board of Health subcommittees, where there was a decision not to implement. Aside from that, you'll see in the appendix that we are certainly looking like we are well on track for the implementation of those recommendations for the organizational standards. As far as the recommendations related to the accountability agreements, there were 6 of those. 2 of the 6 are complete, and the remaining, 4 of the 6 are complete, and the remaining 2 are in progress. And so certainly we are feeling quite optimistic that we will meet those as well, according to our schedule.
So Susan, before I open to questions, there is a lot of information that is provided by the auditors, but in your words, you're feeling comfortable that we're in pretty good shape. And if that is the case, I want to say well done, because I know there is a lot here to be looked at. Questions? None? Marlene, anything from you on this? I know this is a big undertaking.
No, thank you.
No, you're going to be quiet? Okay. Moved by Mr. Brunton and seconded by Mr. Columbus that the memo respecting operational audit, implementation of recommendations be received as information. Any debate on that motion, gentlemen? Hearing none, those in favor? It's carried, thank you. Susan, I believe you have one more memo. We'll go to page 130, and this is a memo on prenatal, postnatal nurse practitioner transition update.
Thank you, Mr. Chair. So through you to the Board of Health, yes, this is my last memo, so it's been quite an agenda. So in this particular case, the prenatal, postnatal nurse practitioner, you'll recall we had the discussion before Christmas around stopping the provision of that prenatal, postnatal services from our nurse practitioner within the health unit. And the reason for that was multifaceted, but really it came down to we didn't believe that we were the best place to provide the service. We believe that this is a service that can better be provided through primary care within our community, that would allow moms and their children to have access to care over the weekends, have access on the evenings, and would allow them to have access to the same clinician throughout their pregnancy, as opposed to what was happening at that time, which was to have mothers transition their prenatal care midway through the pregnancy. Since that time, we have moved forward on the direction of the board with the reduction of the nurse practitioner services related to prenatal and postnatal care. And that was the equivalent of about 2 days a week of service that has been discontinued. And we've been transitioning patients with our final date of service will be this Friday. And then starting next week, we will no longer be offering prenatal and postnatal care through our public health unit. What you'll see in the attached memo is you'll see some of our data related to the services that we had been providing, and this helps to contextualize that over the last number of years, in fact, we were only hitting about a quarter of the targeted number of visits. So certainly it wasn't a service that was being well utilized within our health unit. And that we were also seeing, and this was very good news, I think, for Haldimand and Norfolk County, where we were only about 20% of our visits from clients who didn't have a family physician. So what that means is that actually more people in our community had access to a primary care physician than what they had had in the past. The other area that was of particular concern, I think, to us and to our community was specific to the Mennonite community, because that is certainly a priority and certainly a population that can be quite vulnerable. So we've been working very closely with the Norfolk Roots midwives. They've started to attend the Moms and Tots program at the Norfolk Community Help Center in Frogmore, which does target that particular population. They're also willing to accept new patients, new clients, so that's very good news. We've had communications with the Delhi Family Health Team and the Port Rowan Medical Center. They're willing to take more clients, and certainly it's not reflected here, but we've recently been in contact with a physician who comes from the Waterford area who is willing to travel to that community to be providing care. So we're certainly seeing that there is a very positive response from our community in this transition. What you'll see on page 3 of this particular memo, again, is a bit of an update. Now, the update was prepared back in the early part of March. So since that time, I'm happy to say that 100% of our clients have been connected with services and have been transitioned from our midwife, or from our nurse practitioner, rather. What you'll see on page 4 of the memo is there was some breakdown of the transition of clients. Many clients actually did have a family physician already, so that was certainly very helpful. What we also learned during the time of the transition is that there were 2 new physicians who came on board in the Port Dover community, so that was certainly very helpful. And certainly we've been able to make connection to other physicians. So we're very pleased that this has worked as it has. I do want to say that we are committed to ensuring that that there is some follow-up from our perspective to be sure that we don't miss anybody going forward. And so we are continuing to connect with, in particular, the Mennonite community around are we missing anyone? So we will still have contact with them over the coming months to be sure that their clients are receiving the care that they require. I do want to say that our nurse practitioner from this particular service is continuing with us at the health unit, so very excited to be able to say that. I think wonderful for us that she is continuing on and will be continuing in the nurse practitioner of sexual health, which was the other portion of her role. And so she will be with us starting next week, 3 days a week. Okay. And I think just the final comment, I do want to thank her particularly for her commitment to transitioning clients, because she's worked very hard over this last couple of months to be sure that each and every one of her clients is safely transitioned and is receiving the care in the best place.
That is nice to hear. Mr. Wells?
Thank you very much, Mr. Chair. And Mr. Chair, again, kudos to staff. This decision brought forth quite a reaction when it was first announced, and my question to staff is, has the uproar, the volcano, has it settled down, and are we more on status quo now?
Through the mayor to Councillor Wells, we still continue to get the odd inquiry, and we've had meetings as recently as last week, and we'll continue to do so if there's any concerns. But overall, things have settled a little bit, and we hope that this information memo will answer some further questions. And again, if anyone continues to have questions or inquiries, they're more than free to contact Susan or myself for follow-up.
Thank you. Thank you, Mr. Mayor.
Thank you, Mr. Black.
Chairman, thank you very much. And I mentioned before that this council has appointed me to the Haldimand Norfolk Poverty Action Committee. And the last meeting that I was at, there was this volcano reaction, and I was a little put on the hot seat trying to defend council's position and staff's position, but I don't know how successful I was. I did direct them to Marlene and Susan, but they were concerned about the reduction of the service, and more particularly, I did say some of the things that Susan said, that they still would be serviced, but their concern was that some of these people didn't have transportation. And I guess was the nurse that we had, practitioner, she was actually traveling and going to visit them at their homes versus them now having to travel to see a doctor some distance. So that's about the only thing I can think that was still a concern to them, and maybe you've spoken to them since, but I don't know. I wonder if I can get a response on that.
For sure. Thank you. And through you, Mr. Chair. So our nurse practitioner actually didn't do home visits. So she provided some service through a clinic in Langton. She provided some service through, for example, the Community Help Center in Frogmore that was targeting specifically to the Mennonite population. So what we have done, though, is we've been working with others. So Norfolk Roots Midwives, for example, is now going into the help center in Frogmore. So they will be providing that service so that people have access because they're there. We've also been having some conversation about, what other creative solutions might we have. So this physician from Waterford who is willing to go there, could she be providing, can we do something with her to make some clinic space available or help her secure clinic space in that area so that she can go and provide the services there. So we are working very creatively with those partners, and we'll continue to do that. I do also want to say, though, our Healthy Babies, Healthy Children program, which does provide in-home visits, is still continuing to be available. So that is something where every mother who has a baby is assessed for risk. And if it is somebody who is determined to be with risk, then we do provide that service, and we'll continue to provide that service through the health unit. We'll continue with our breastfeeding supports. We'll continue with our prenatal classes, all of those services, and our vaccination clinics, which is another area of concern, I think, for the little guys, because this service also was children up to age 6. And so we'll continue with our vaccination clinics. So health unit will still support.
Thank you very much. And secondly, were you approached by the Poverty Action Partnership of Haltom and Norfolk? Because I did send them over to you. I'm just hoping that maybe you had a discussion with them, and that the next meeting I won't have to answer any more questions.
Through you, Mr. Chair, we weren't approached specifically by them, but we do have members who sit on that committee, and we certainly have tried to communicate with our staff as broadly as possible to be ensure that the information is flowing.
Well, I know, again, at that meeting, the actual employees of the health unit excused themselves from that part of the discussion. So they weren't able to convey any information. They felt that maybe they had a pecuniary interest. So I don't know. I just hope that that group, communicates with you. And if you want, I can give you a name. I'm sure you know all the people on there. So, okay, thank you.
Mr. Oliver?
Mr. Chairman, I think I'll pass on my question, but just on Councillor Black's last point, this report or this memorandum was very helpful to me as a member of the board and to all of us, and I'm sure could be communicated with the Poverty Action Group. Good, thank you.
Mr. Columbus, thank you.
Mr. Chairman, just a philosophical question to Susan. What did families do 50, 60 years ago when there was not this service available?
So I think through you, Mr. Chair, I think that our landscape is very different, and from a prenatal care perspective, 50 years ago was after I was born. So I was going to say it was before my time, but it's really not. So we did have that moment in time where historically, women had babies with midwives at home, and then we medicalized it. So women, went into hospital and everything was very medicalized, and then we've sort of gone the other way. We didn't necessarily have the full spectrum of prenatal support that we do now, but I think we do have better child outcomes or childhood outcomes. We have lower mortality rates and lower morbidity, so less children have complications in their early and ongoing lives. So I think we do have better rates because of the array of services. I think for us the tricky part is always knowing what's ours to provide and what needs to be provided elsewhere, and this was one that we felt very strongly belonged in primary care. We can't be primary care, we are public health.
Thank you. You've answered that question well.
Anything further? Moved by Mr. Brunton, seconded by Mr. Columbus, that the memo respecting prenatal, postnatal nurse practitioner transition update received as information. Discussion? Those in favor? Carried. Thank you very much. I think that's enough memos for one meeting. Susan, thank you very much for all your work and your presentations. Communications is next. There are 8 items. Under item 4, communications, I'm going to go through them quickly. If anybody then wishes to signal in on one and ask a question or comment or have further action, we'll deal with it. The first one is on expanded funding request for Lyme disease. The second communication is possibly expanding the grade 7 HPV immunization program. Student nutrition programs is next. These are all from the municipality of Durham. Nutritious food basket, followed by marketing of food and beverages to children. Huron County has the next 3 healthy eating strategies. 2 bills are listed there. Next one is HPV immunization program funding again. And finally, Huron County has communication on opioid addiction and overdose. Is there any of those you wish to comment or discuss? Mr. Height, please, if you tell us which one it is, we'll go to it.
Thank you, Mr. Chair. My concern is the Lyme disease one.
Yes.
Do we need a recommendation, or how do we keep that moving along? As you're aware, Long Point is one of the first places with Lyme disease in Ontario, and it's still out there, and with the mild winter that we've had, I don't suspect the ticks will be frozen.
What we could do is we could simply endorse and forward our recommendation, which would be along the same lines as what is here before us from Durham region.
You need a motion or show
I
of
think a
hands?
motion is in order, so go ahead and tell me what you want to do, and I'll get a seconder, and away we go.
Put the motion on that we endorse that.
Thank you very much, and a seconder is Councillor Oliver. Does anybody wish to speak to that we in fact send our endorsement? And as you can see, it's listed there to the appropriate ministries and other agencies to send that. Discussion? You've got that motion? I'm not going to read it. Those in favor of that motion? That is carried, and thank you very much. I agree wholeheartedly. Anything further on those communications? Moved by Mr. Wells, seconded by Mr. Brunton, that correspondent items A through H, as outlined in our agenda package, be received as information. Discussion? Those in favor? It's carried. Thank you. You are quick. Thank you very much, sir. Yeah, just the confirming bylaw. Any other business to bring before this Board of Health? And then what I have left is the confirming bylaw, and before I do that again, thank you, Marlene, you and your staff, and certainly Susan and Dr. Locke, again, your presence here is appreciated. Thank you, sir. Moved by Mr. Wells, seconded by Mr. Brunton, that bylaw 2017-04, Board of Health, it's a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held here on the 28th day of March 2017. All in favor? Yes.
Missed the motion, or?
No, and the clerk will explain why.
What's that? Oh, yeah,
The
okay.
clerk will
there's-
explain why. You're raising a good point,
Yeah.
because I just asked him
Yeah.
3 minutes ago. Go ahead.
My apologies. Through you, Mr. Chair, that was placed on the agenda just to ensure that we did approve the budget. You've approved the Board of Health budget earlier through a staff report this evening. So the Board of Health budget is final.
So
the
we've
motion
we've
is
done
no
that
longer
already.
We did it
required.
previously in one of the
Okay.
staff reports.
Thank you.
I asked the same question. You're very smart. Thank you. If you're going to sit there and heckle me, Councillor Wells, I'm not going to allow you to have a break. Anything further, Mr. Wells? I thought you might see the light. We are now adjourned, and we will recess at 5 o'clock, which will be in about 13 minutes for our council meeting. Thank you.
On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of North, on a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom.